Masa tu saya dalam kereta nak ke Pekan, tiba-tiba pengsan. Dan saya sebelum ni memang tak pernah pengsan pun. Itu baru first time dalam hidup saya merasa pengsan. Nak buat apa-apa pun memang kena berhati-hatilah sebab kadang-kadang tengah masak, jatuh. Tengah duduk pun boleh pengsan.
She initially saw me in 2021 with frequent fainting spells, so severe that one point of time she almost had like a seizure activity. So she's seen many doctors, including a neurologist, who have excluded a neurological cause for her symptoms. Puan Sarwana was diagnosed to have a rare type of 𝗵𝗶𝗱𝗁𝗀𝗃 called a cardio-inhibitory syncope. This type of syncope is difficult to diagnose as this patient has very infrequent symptoms. Many cardiac tests was done. Unfortunately, all the preliminary tests was normal and she has to undergo an electrophysiology study and also insertion of a device called a root recorder that implanted under the skin. 3 months after the implantation of the cardiac monitor, she has detected to have a long heart rhythm pause of 24 seconds and causes her to have another fainting episode. This is how she was diagnosed with this condition. Conventionally, the treatment for cardio-inhibitory syncope is the implantation of a pacemaker. After discussion with Puan Sarwana, she was reluctant to have a pacemaker implanted, and we have discussed other options. These include radio frequency ablation, which is called a cardio-neural ablation for her. Cardio-neural ablation was done and she actually felt much better for the next 1 year. Unfortunately, the disease relapsed and able to capture again a 10-second pause in her loop recorder. After the second round of fainting episodes, again we discussed the options of ablation and also pacemaker implantation. She is willing to go for a second attempt of cardio-neural ablation. She remained quite well after the second ablation for the next 1 year. Unfortunately, the symptom came back and she had giddiness and also a pause recorded on her loop recorder. I strongly recommended her to undergo pacemaker implantation this round.
Saya rasa masa masukkan pacemaker tu okey je lah. Tak ada tu sebab dia cuma pembedahan kecil. Jadi mula-mula masa sebelum buat tu saya memang takut lah kan. Tapi bila dah buat, okey, tak ada apa. Sehari je dah boleh, esoknya dah boleh keluar. Selepas saya masuk pacemaker, saya boleh menjalani kehidupan macam sebelum ni lah, sebelum saya sakit. Saya boleh drive sendiri tanpa ada orang yang teman. Saya boleh ke mana-mana, saya boleh melakukan aktiviti sukan tanpa ada sebarang masalah.
In general, anyone that has fainting spell should be assessed by a neurologist or a cardiologist. Basic tests such as ECG, echocardiogram, Holter monitoring, and sometimes EEG or the imaging of the brain would be ordered by the doctor. She's always a very jovial person, and of course, she has no fear of further fainting episode anymore.